This is Average Joe PT. In our last episode, we specifically talked about shoulder impingement and the various treatments and the causes of shoulder impingement. I'm going to leave a link up there. After this episode, hopefully you'll go back and look at that to give you some ideas and some just basic education that you might give to other people and your loved ones. This episode specifically, we're going to go back up the chain and we're going to talk specifically about disc herniations in the neck and the three main things that you have to worry about when you're having neck and disc issues, or even if you're having a disc issue. So let's go ahead and stay tuned. We're going to start on cervical disc issues. The cervical spine is a scary place to start to have pain. Now, you can have pain for any number of reasons in your neck. It could literally be because maybe you watched too much TV, you looked at your phone too long, you looked at a computer and that was bothering your neck for a while. Maybe you got into something serious like a car crash and afterwards you had all this neck symptoms. So we're going to talk about the three main concerns that you're going to have and you need to look out for if you're having some neck issues, and do you really know whether it's coming from just a muscle pain or if we have to worry about the cervical disc. So let's start with the anatomy. So when we look at the spine itself, we literally see all the vertebrae, and they're very small in the neck. And there's 7 of them that make up that. And within each one of those discs in between there, you have a little soft tissue in there. And that's kind of like our shock absorber, our cushion. And that really helps to reduce the actual stress when you have a trauma, or if it's repetitive, like I said, by either watching too much TV, looking down, looking at your phone for long periods of time. But when we come back and we look at what happens, so I'm going to zoom right in here now. If we look at it, and I'm just going to kind of push and animate out, what happens is 99% of the time, if you have some symptoms going down your arm, which is number one symptom of a disc issue, is that you're having pain that travels past your elbow. So that's number one to look out for. And I want you to keep watching because I'm going to talk about the other 2 reasons why and the concerns that you have to look out for that, it's a herniated disc. So number one is that symptoms are traveling past your elbow, and that's because it's pushing back. And then what happens is it does go back in, but you have this cascade effect of the inflammation around the nerves that the disc just pushed into. Now, when we looked at the anatomy, the nerves are all on the outside of the disc. So that disc has to tear and push into the nerve, because within the disc space itself, there are no nerve endings. So you can have multiple tears in the disc throughout your whole life, and you're not going to know there's anything wrong until it really starts to encroach upon these nerves on the very sides that branch off of the spinal cord themselves. And that's when you start to have symptoms down your arm. Now, the inflammation, as we age, that inflammation could be not caused by a disc, it could be caused by a facet joint being inflamed. And so I'm going to leave a link up here of another old facet joint video I did a while back that will kind of give you some ideas of, hey, do I have a disc issue, or if I'm dealing with a facet syndrome issue in my neck that's causing my symptoms down my arm. On this episode, we're specifically just talking about the disc itself. So that's number one, that referral pain past that elbow, burning, numbness sensation. That's like, I'm not dealing with just muscle pain. I'm dealing with something more serious, and that's definitely a red alert. So number 2 that you have to look out for is what I just talked about. Numbness and burning and tingling. That's because that nerve is being inflamed along that chain, coming from the neck and going all the way down the arm and in possibly into the hands and the fingers. Now, there's specific nerves in our neck that match the specific fingerprints that we have. And so if we do a letter OK here, this right here, if you have any symptoms around your fingers here, this is actually your C6 nerve. All right, if we travel all the way down your neck and we looked at the number 6 vertebrae and that 6th nerve that comes out there, that's where your problem is coming from. So that's The OK sign is the C6 nerve. Then you have C7, then you have C8, and then you have T1, that thoracic number 1 at the very top, where it's your vertebrae in your neck stops at C7, and then you have that T1. Okay, so that nerve at C7, excuse me, in T1, you have a C8 nerve in there. And so you have 7 vertebrae in your neck, but you actually have 8 spinal nerves coming out. And so you have that 8th nerve ending in there as you get into that T1 vertebrae. That T1 vertebrae I show here is literally in blue. So we have the pink is all your cervical spine, you have the base of your skull, and then as we come down to T1, T2, and then all the way down to T12, which you have 12 thoracic vertebrae, and you have 7 cervical vertebrae. And so when we're looking at that number 2 issue is the numbness and burning symptoms going down into the hand past that elbow. Number 3, so I want you to look, keep watching, because we're going to get to that number 3 in just a second. If you like this video, I want you to leave a thumbs up, okay, so we can get this video out to other people to help them out, because that's what I want to do. I want to help other people. You know, if you have this knowledge, because the first thing you think of is, oh my Lord, I hurt myself, I have symptoms in my hand or down my arm, what's going on? And so it'll help reduce the anxiety by just having some knowledge. Obviously, this is for education only. This is not diagnosing anything. You definitely want to see your professional for that. But at least this will really help you, give you some confidence, and hopefully reduce your worries. And we're going to talk about some treatments afterwards. So we're going to go all the way to the end now. Make sure you watch this, because I'm going to go over some treatments at the very end that you can do at home to help you reduce some of your herniated disc issues. So the next thing we want to talk about here is when back in the day they talked about, oh yeah, the disc comes out like a jelly donut, and and you push it back in. The reality here is when that disc gets pushed out, it goes in and out every time you move your neck around. So if you move your neck up, you move your neck down, you look left, you look right, that disc at that point is pretty unstable. What has to happen is that inflammation period has to calm down. So I always talk about that 72 hours period of time, but really that inflammation period is really the highest, and hopefully will start to go down after that. Nerve inflammation, warning right there, takes the longest to get to calm down. If we were talking about muscle, if we're talking about tendons, if we're talking about ligaments, those have a lot more blood flow in them. The nerves really don't. So the nerves take that much longer to calm down when it comes to being traumatized by inflammation. So nerve pain, expect to take a little bit longer than any other type of irritation to calm down. And so when we talk about that, we're looking at number 3 now. Number 3 is we're looking at weakness. If you start to have weakness in your grip, feels like you're dropping things, feels like it's heavy, your whole arm is heavy, that's number 3 concern, that you're dealing with this cervical disc issue. You're not dealing with just muscle pain. You might be dealing with a facet joint issue, but more times than not, you're dealing with a nerve that got inflamed by it. Either it's an old disc issue, or you traumatized it somehow with what we discussed earlier in this video. That's number 3. So we have the 3 here, okay? We have number 1, we have that whole trauma being caused, whether it's from a fall, whether it's from looking down too hard, all right? And we have that issue where the symptoms go past your elbow. That's number 1. Number 2 is that the tingling, burning, numbness sensation going past that elbow. And then number 3 is I have some weakness, or grip strength is just not there, or it feels heavy. Those are your 3 classic signs that you're having some sort of disc issue. I'm going to give you a 4th one. Number 4, if your arm cannot go over your head, and prior to that your arm could go over your head, that is a huge red flag right there that you're dealing with a disc issue in your neck. If you never had a shoulder problem, there was no trauma to your shoulder while you were throwing something, you fell on it, you were looking down too long, you slept wrong, maybe you lifted something wrong, and all of a sudden it seems like you can't lift your arm overhead and you're kind of doing one of these things, that is a red flag that you're dealing with a disc problem. Okay, so that was the number 4. That's the caveat number 4. So let's go ahead and talk about some treatments now that you can do at home to hopefully reduce this issue in your neck. So treatment number 1, I always talk about it. For the first 72 hours, you want to reduce the inflammation by icing it, resting it, and anti-inflammatories. I cannot talk about that enough. Those big 3 things you want to do. Okay, and then stop doing the activity that caused the problem in the first place. That should be obvious. Okay, once you get past that 3-4 day mark, you want to make sure that you have good range of motion back in your neck and that you're not getting your symptoms down your arm anymore. If you are, clear case, you're probably going to need to follow up with your doctor because your symptoms should have hopefully started to calm down after that 3 to 4 days. If they have calmed down and your motion is improving, I'll leave some links up there of some neck exercises you can do that I've shown you in the past videos. So I want you to watch the rest of this and then go to that. So the next thing after you got your motion back is I want you to work on your posture, because as you get your back upright, your head naturally falls back into place. You're not dealing with a huge forward head, which puts a lot of stress on those necks. So when you have, I'm going to show them this model here, when you have a forward head like that, that puts a lot of stress on the bones and the disc. So we want to work on that upper back to pull it back in line. When it does, your head naturally falls back into place, which obviously reduces a lot of stress on the vertebrae in your neck. So that's number 2 when we're looking at treatments. So we got the medication, that whole 72-hour phase. Then we got your range of motion, improving that afterwards, just basic range of motion. Then you want to work on your posture. And then you want to work on some basic strengthening exercises just for your upper back. Don't worry about strengthening your neck. Okay? You're not going to be playing football or baseball or something like that. So you just want to work on getting your motion back. You want to work on strengthening as your symptoms start to resolve. And how should you see improvement? Your weakness goes away. The nerve symptoms, burning, tingling symptoms go away from the hand, and they start to recede back to where they came from. As your nerve symptoms resolve out of your hands, okay, you're going to feel more symptoms back in your neck. It's called centralization of your symptoms. So that's a positive sign that you're improving. All right, so there you go. There's some treatment ideas that you can do at home. And so if you like this episode, I want you to leave a DM down below. If you have any questions at all, I'll try and get to them as best as I can. I do a few other types of videos on this channel that I want you guys to look at. I do a research base. I'll be doing one on the cervical spine and the disc issue, so I want you to watch out for that video. That will probably come up in the next few days. And then also I do my walks a couple times a week, and so hope you'll reach out for those. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.